Welcome to the Pharma Voice Editor's Take video series, filmed live at the 2012 DIA Annual Meeting in Philadelphia. Hosted by Taryn Grome, editor of Pharma Voice. In this session, Taryn meets with Bill Gwinn, VP, Clinical Informatics Solutions, OptumInsight.
We're on the floor of the 2012 DIA conference with Bill Gwinn. Thank you for joining us again this year for our Editor's Take video program.
Thank you, Taryn. It's a real pleasure to be here.
As always, we can't wait to hear what your thoughts are on some of the current trends and challenges in the patient space. So talk to us a little bit about best practices for finding the right patients and the right investigators for clinical studies.
Well, there are a lot of things out there, and there are a lot of different techniques, but finding the right people and the patients that you need for a clinical trial begins with finding the right investigators and the investigators that actually have those patients. In this industry, it's been a traditional model to send fax-blasted questionnaires to investigators, and in those questionnaires they will identify how many patients that they think they have. Now, they make a sincere effort to do that accurately, but as a practical matter, there's not enough time to do a chart review. Most investigators do not have current electronic medical record data, and so what happens is that they guess. Survey shows that they perhaps spend 30 minutes answering that part of the questionnaire, and that's not really enough time for an accurate answer. So what the clinical trial sponsors need to do instead in finding the investigators with the patients is starting to rely on objective metrics. Now, one of the ones I'm very fond of is insurance claims information, which can count the patients objectively. And doing that, you can find people that really do have the patients, not only in a general way, but also in a way where they match all of the criteria that go in a clinical trial protocol. The data work, and my company compares our insurance claims data to the questionnaire, and we have found up to a 10 times difference between what is in the questionnaire and what the claims data says the investigator really has. So taking an objective approach with objective data sources is really a superior technique in finding the investigators that have the patients. Now, the last part of this story is if you fish where the fish are and find the investigators who have the most patients, they will randomize or enroll those patients much more quickly.
Thank you so much. Those are terrific insights. Now I want to talk a little bit about how data-driven approaches can help determine protocol feasibility and site identification.
Well, protocol feasibility and site identification fall into two different buckets. Let me start with protocol feasibility. There's been a lot of talk at this conference about how to do the feasibility in the best way, and there's speech after speech about how feasibility doesn't go so well because of what amounts to poor planning. One tool in designing a protocol is taking objective insurance claims metrics to see if the patients really exist. Now, anyone familiar with protocols know that any protocol has a big section called patient inclusion and exclusion criteria. They're the medical specifications of those patients. The first part of that is usually pretty easy. If you say diabetic patients, well, you probably know how many diabetic patients are out there just from reading the newspaper, if nothing else. But then you say, well, I need diabetics that don't have high blood pressure, and now if you make up something bizarre, maybe I need a diabetic who's had a kneecap replacement. Well, then you're getting into higher degrees of specificity and a much higher degree of uncertainty as to whether those patients really exist. And what clients tend to do is use questionnaires to investigators to see if the patients exist, but the questionnaires are too general and people don't have enough time to answer them. So what happens is you can get a false sense of security that that highly specified patient actually exists. Now, the alternative approach to that, and it's also related to site identification, is to take objective metrics. It can be electronic medical records or something other than just general survey stuff so that you can be very specific. Now, I'm very fond of using insurance claims for that purpose, and what we can do, and anybody can do with an insurance claims database, is build a data set with on and off switches, typically in SAS programming, but you can construct these on and off switches and turn each specification on or off to see if patients really exist as you turn additional switches on. Now, I do this a lot personally in my career, and sometimes if you turn all the switches to the on position, you might lose 90 or 95% of the patients that you thought were there. Now, that's not necessarily bad. It happens all the time in cancer trials to lose that many. But you have to plan for it, and that goes to the core of a protocol feasibility. Can you really do it? And you can get those objective metrics that help. Those same objective metrics can identify which investigators have patients that match all of those feasibility criteria.
Bill, I want to thank you so much for sharing your expert insights with us again.
It's always a pleasure.
Additional Editors Take videos, as well as podcasts, white papers, webinars, and more, are available in the resources area at www.pharmavoice.com.